A member of the public has collapsed at the clubhouse.
15.
2 lifesavers arrive at the scene with oxyviva and defibrillator.
I'm here with the defib. You're doing great. I'm going to set up. I'll tell you when to stop.
9, 30. Breath. Breath.
Use the
1.
mask and resus tube for the current cycle.
The defib operator checks the patient's chest, removes any clothing, jewellery or hair that may impede shocking, then turns on the AED, removes the protective cover from the sticky surface of the pads and places them appropriately.
28, 29, 30. Breath.
Peel white
Breath.
pads from
1.
grey plastic case.
Once the pads are in place, the AED will assess the patient to determine whether or not a shock is to be delivered.
Stay clear of patient.
All lifesavers will need to listen carefully to the instructions given by the AED.
Analysing heart rhythm. Shock advised.
Shocking.
Oxygen off.
Shocking now.
Delivered.
Shock
Be sure
delivered.
the ambulance service has been called. It is safe to touch the
Okay,
patient.
Recommencing CPR.
Start CPR.
2-person CPR would continue as required, with the ART operator providing the breathing via the oxyviva.
Patient coughing. Checking airways. Airways are clear.
The team roll the patient onto their side and continue to assess the patient's breathing.
Continuing to monitor patient. Changing to therapy, oxygen, and flow rate 8.
The patient's breathing will need to be monitored closely by the ART operator until ambulance personnel arrive.
So, what's your name? Can you hear me?
The defibrillator pads and the defibrillator should be left on in case the patient deteriorates suddenly and requires further shocks.
Do you know where you are?
The assisting lifesavers will make the patient as comfortable as possible, keeping them warm and managing any symptoms that present.
No, are you on any medication?